This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in the Vince Lombardi Cancer Clinic. We're going to be focusing on lung cancer, and we're going to be speaking with medical oncologist Dr. Shamsuddin Virani. Well, thank you for taking some time with us once again. Always enjoy talking to you. Lung cancer specialist. Why did you choose lung cancer as one of your specialties?
So lung cancer is one of the top most diagnosed cancers in the United States. It is the second most common cancers in men, and I believe by far in women as well. More than 200,000 cases of lung cancers are diagnosed each year as per the American Cancer Society, and lung cancer accounts for 27% of all cancer-related deaths. That is more than breast, colon, and prostate cancer combined. And if you look at the statistics, lung cancer is a disease of the older population. So 2 out of 3 people that are diagnosed with lung cancer are age 65 or older. So it is a very important health determinant in patients who are in an aging population. So I think it's a very, very important diagnosis to focus on. At the same point in time, it's a very exciting time for lung cancer. Just because our understanding of the biology, and if you remember from my prior discussion with you about biology and breast cancer, our understanding of the biology and what promotes growth of lung cancers is rapidly improving. And we know about molecular pathways now and have targeted therapies that we could use against lung cancer. So it is really an exciting time.
An exciting time to treat that once you have that. But are there some things that we can do through our daily lives to help prevent lung cancer? And what are some of those risk factors of getting lung cancer?
Sure. As you probably know, smoking is one of the major risk factors. So almost 87% of lung cancers are related with smoking. The longer you smoke for and the more you smoke, the risk factor increases. There's also a risk factor of passive smoking, and unfortunately 2,000 to 3,000 cases in the United States each year are diagnosed in patients who are exposed to passive smoking. Then there is asbestos exposure, radon gas exposure, and although we don't have a clear-cut genetic link, but there are theorists out there who postulate that there is a possibility, which again needs to be considered too. But more so, the modifiable risk factor-wise, we're looking at smoking as one of the major determinants of ill health and cancer.
Yeah, so it's something that we can really do to avoid lung cancer is just not smoke, obviously, or be around smokers. Symptom-wise, how do you know if you're developing lung cancer?
So there are certain specific ones to lung cancer that I would say, and then there are certain general cancer symptoms. Concerning symptoms, of course, if you're a smoker, if you develop a productive cough and blood or blood streaks, that would be concerning. Unexplained weight loss, unintentional weight loss, night sweats, and pain, depending on where the cancer is located at. Those would be some general symptoms to look out for.
Yeah, so there are some things that you might not associate with lung cancer that could be lung cancer. Are there screening programs or things that we can do to help detect or have early detection of lung cancer?
Absolutely, and the United States Preventive Services Task Force has issued a recommendation that people who are between 55 and 80 years of age and who have 30 pack years or more of smoking history and are currently smoking, or those that have quit within past 15 years should have an annual low-dose CT scan, which would be a form of screening.
And I would imagine the earlier you detect lung cancer, the better your chances of survival?
Absolutely. So the earlier stage would mean it is more surgically resectable, and that is important in the grand scheme of things. Of course, it could range from a local disease to locally advanced disease where it's spread to the lymph nodes, or a distant metastatic disease, which essentially means going to other organs such as the liver, bones, brain, and adrenal glands. And so depending on the stage, surgical resection may or may not be a possibility. And of course, we could use other modalities such as chemotherapy and radiation. So the earlier stage, the better, of course.
So there is hope if you are diagnosed with cancer. And I know one of the things that you're doing here at Aurora, started in 2014, is really trying to make it a better experience, a very difficult situation, a better experience for the patient.
Yes, I believe you're talking about the multidisciplinary clinic. So what that is instead of the patient having to go and seek opinion from medical oncology, radiation oncology, and the surgeons, we have an approach where the patient comes in and sees the medical radiation oncologist and gets an opinion from the surgeon in one sitting. And what we do is we collaborate with our surgeons at St. Luke's, and there is a surgeon that comes all the way up to Oshkosh to see the patients. And so the idea is to provide a high quality, best standard of practice care in a multidisciplinary fashion, and that's what we're achieving and aiming to do.
All right. Well, Dr. Virani, we appreciate you taking some time with us once again.
Thank you.
If you have any questions or concerns about lung cancer, you should always check with your primary care provider, or you can give us a call at Aurora at 303-8700. Dr. Virani is available at the Aurora Medical Center in both Oshkosh and Fond du Lac. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.